of the Science Department at Jackson College, Dr. Matthew Badtke. Good morning, Matt.
Good morning.
Do you remember, are you old enough to remember when the mall had the Gap?
Absolutely. Yeah. I went there when I was in high school, I'm sure.
It's gone? The Gap's gone?
I don't know. I mean, I think, isn't it? Brandon, is the Gap gone?
Absolutely.
Yeah.
I have no clue.
He doesn't know. Brandon only shopped at Spencer's Gifts.
Yeah, there you go. It's all Spencer's.
I've been there a few times too. Yeah.
Well, here we are approaching winter,
Yep.
and this will be what, our third winter in the pandemic?
Third, yeah.
Third, wow. So let's talk about the upcoming cold and flu season
Right.
and the prognosis for what is going to happen with the COVID virus as we get more indoors.
I think that one thing we have seen is that, we can predict and we can try to guess, but nobody really knows exactly what will happen. I think it's assumed that there probably will be some uptick in cases as you get people moving indoors, as you get people more in enclosed spaces again, as it gets colder out. But we'll see. We also have a lot higher percentage of folks that have either been sick or have had the vaccine. We now have a new bivalent vaccine, and all that means is you have two different viruses in the vaccine. So you have the original one, and then you also have the Omicron strain as well, which is the more current circulating strain right now. So there's hope that if more folks get that booster this fall, that probably will provide some protection, a couple months at least, for infection. And then, we'll just see what happens. But I think that it wouldn't surprise me if cases went up a little bit.
Will this be maybe the first winter that we can identify as cold, flu, and COVID season?
That's what people thought last year too. I remember everybody saying, oh boy, this is gonna be a terrible flu season, and then that never happened. So we'll see. At some point you would think that it's been a couple years now since we've seen a high number of flu cases. There, you would think, would be less immunity in the population, and so it's certainly possible that we could see an uptick, but again, it remains to be seen.
Yeah, so that first year there was practically
no flu.
none.
Nope.
Yeah.
Nope.
So, and it was the safety protocols
Yeah.
that prevented the spread of flu.
Yep.
What are officials recommending, or who even cares what officials recommend? What are you recommending for the safety of the community?
Well, I think that at this point, really the best things to do are to just really be aware of if you are sick, stay vigilant about that, and stay away from folks and stay isolated. So you try to prevent that from being spread. Get up to date with a booster if it's been, 3, 6, 9, 12 months since you've had your vaccine or your booster. It's probably a good time to think about getting this updated bivalent booster. That would be a good idea as well. And then that's the biggest thing, is I think just remain vigilant about it. It's easy, everybody wants to move on and not think about it anymore, but I think that it's just one of those things that it's around. It's going to be another virus that we have to deal with that circulates through the population. So just be aware of it and be thinking about if you're sick, stay home.
And I know that the treatment, especially for the older individuals that are able to get the antibodies, I've talked to some people that have had that, and it's amazing what that does to the virus. It's almost like someone described it to me as, kind of like I almost got an IV and felt back to normal.
Right, and we also have Paxlovid now, which is pretty common, that if you start feeling sick, you can take that, and it seems to, in a lot of folks, prevent those more severe symptoms. Now, people have seen sometimes you get sort of a rebound case where you kind of get a little bit sick again after you take it. That's been seen. I've heard a number of people say that they've experienced that when they have taken it, but it prevents those more severe symptoms.
Early in the pandemic, we were seeing disparities in health, access to care
Right.
particularly among minorities. The
Mhm.
deaths, I think, were higher,
Yeah.
and the incidence of transmission higher in certain minority communities.
Yeah.
Has that changed?
Yeah, so that's been some really interesting news, especially in the last, I would say, 9 months or so into 2022. So early in the pandemic, we did see very big disparities. African American populations oftentimes had way higher incidence of both infection and deaths. And interestingly enough, that has really changed. And the data over the last couple months, the rates of both infection and death have pretty much evened out across the board, across all groups. And it seems to be a lot of work that has been done both at the federal level and at the community level as well. So a lot of community health organizations making sure that they're getting out there, letting people know that vaccines are available, letting people know about what to look for, be more aware of the disease. And it seems to have really made a difference. And I think that a lot of times we get really hung up on sort of the negative things, and we don't often talk about positive stories with this. But this is one really positive that has been coming clear over the last 6 months or so, is that those disparities that a lot of people thought, well, maybe is it just some inherent difference or more pre-existing conditions or what? It seems like we can overcome those things by working hard at the local level and making sure that folks are getting the information and getting the treatments and getting the vaccines and things that they need. So I think that's a real positive.
And I think here in our community, there was special outreach to make sure that there weren't people forgotten and left out, particularly with the vaccine. And now we
Exactly.
are here, another vaccine season, the booster, it's a reformulated
Right.
booster.
Yep.
And the recommendation is for someone who, how long ago got their last booster?
I think if it's been 2 to 3 months, either since you've been sick or since you've gotten your last vaccine, you probably could get it. So I think if it's been a while for folks, if you can't remember when it was that you got the vaccine, that's probably a good time to think about the booster now.
The testing too. I think we're seeing the number of cases being reported by state health department is down, but they're also saying it's because people aren't testing.
Right.
Should people, if they do feel like, well, this might be COVID, get one of those home tests, or should they go to a medical facility?
Well, I think that there have been a number of tests that have been offered that were available for free. There were some websites, I think at the federal level, that if you signed up, they would send you some free tests. And so hopefully folks took advantage of those, because I think in certain circumstances, I think it is a really good idea to do that. Now, if you're just deciding whether to stay home from work or something, just stay home if you're sick. But maybe you have a gathering or something, or an event with a large group of people. Might not be a bad idea to test just to make sure that it's not COVID before you go out and interact, or you can decide if maybe I need to wear a mask, or maybe I need to be more distanced than if I do test positive.
Yeah, that's one thing that I think has changed. When someone's sick, people are staying home.
Yeah, and people don't want to buy those tests anymore either. It's
No.
financial situation as well out
Oh, they
there.
are. They're expensive.
They are,
Sure.
yeah, and that's it's
Remember
not something
people-
people want to spend money on.
When you're sick, you'd have to. Some places require a doctor's note. If you can't go to work, or you have to call and do the fake.
We do that here. You have to call and cough. That's what we do.
I know at the college, our president's been real clear about it's, if you're sick, stay home. And
Yeah.
then that's really the end of it. So I think that's a great thing.
Yeah. Thanks for being with us today.
Yep.
We always appreciate it.
Great to be here.
Dr. Matthew Badtke from Jackson College. Coming up next, we're going to learn about an opportunity